Hi, my name is Dr. Ron Zokel. I'm the director of the Pacific Implant Institute located in Vancouver, Canada. The Pacific Implant Institute provides advanced studies and clinical instruction in the provision of oral implantology, surgical, and prosthetic procedures. An interesting thing happened about a year and a half ago. A visiting dentist from Chicago was inquiring whether or not there was sufficient work to be done in his practice that would make a return on an investment an appropriate business decision. The cost of both the surgical and prosthetic training in oral implantology is significant, and he wanted to make sure that there was adequate reward on his side when he finished his program with the Pacific Implant Institute. In order to get an understanding of whether or not the return on investment was feasible for this gentleman, I developed a spreadsheet which provided information to me that was absolutely astounding, and I think you'll find yourself that the information is very, very interesting, and I encourage you to have a look with me at what this gentleman found when we took a look at his practice. In front of you is a spreadsheet entitled Practice Potential Worksheet. It has a number of areas of data on the left-hand side being the fees that one would charge, be it for implants, crowns, or full arch prosthesis. Full arch prosthesis could be fixed hybrids or bar overdentures as a removal prosthesis. On the center of the screen we have three areas, the uppermost being the demographics of your practice. In other words, how many edentulous mandibles do you have in your practice, how many edentulous maxillas, how many premaxillas that are missing two or more teeth, likewise posterior maxillary areas or posterior mandibular areas. Given the number of sites there, we can presume how many implants will be necessary to restore those areas to full function. And underneath those demographics we have bone grafting, because certainly when teeth are missed we find that a good deal of bone is lost, and if we don't return sufficient bone volume to that area, long-term provisions of implant services will not be realized. And at the bottom, of course, the reason why we do implants is to provide the prosthetic services, and that includes crown and bridge work, or as we mentioned before in the section on the left, fixed hybrid prostheses as well as bar overdentures. Now this is a bit of a wake-up call. The reality is that when we put your data in, indeed if you take a pencil and paper and you jot down your numbers, you can compare them to the conservative numbers we'll place in these areas, and the total you'll see at the bottom is going to astound you. And you need to realize how much work is either being lost or avoided by not undertaking these services within your practice. Let's start by applying fees to the services that you might provide in your practice. Now, what is the charge that you normally will provide for your implant services, or the charges that somebody in your area is likely to charge for an average implant? Often these numbers come in somewhere between $1,500 to $3,000 depending on the area of the country that you might be in, and it's not uncommon for services to be provided in the area of $2,000 to $2,300. So let's choose for our purposes a conservative $1,800 for an implant. The crown that will go on that implant is a little different, of course, than regular crown on a natural tooth, because it has components and materials and such that are consumed in its construction, a transition from the implant to the crown itself. So the cost is usually a bit higher, and it's not unlikely that it is about 1.5 times the normal fee that you have for a natural tooth. And that might come to approximately $1,200 to $1,500 depending on where you are. Let's use a conservative number, say $1,000 for a single implant crown. Hybrids, on the other hand, are full arch prostheses, and the rehabilitation of a full arch very often commands a fee of as much as $10,000 to $12,000 plus materials. Let's, in our case, use a number, let's call it $8,500. That probably is a little light, but like all the other procedures, will be certainly more conservative, and that may validate the numbers as far as you're concerned. Let's take a look at the demographics section of this spreadsheet. It's comprised of 5 different items that we want to evaluate. One is the number of edentulous mandibles. And when we're considering the replacement of an edentulous mandible with some type of an implant-supported prosthesis, we're going to presume we're going to use 5 implants to support that mandible. We might use 7, we might use 4, but for our purposes today, let's use 5. The number of edentulous maxillas will tend to exceed those of the mandible, and because the bone quality in the maxilla is significantly poor in its density, we often need more implants in the maxilla than we do in the mandible. Hence, we will presume that we'll be using 8 implants per edentulous maxilla. Premaxillas that are missing 2 or more teeth are also one of the factors that we will evaluate, and this includes not only premaxillas that have 2 missing teeth that need restoration right now, but also bridges that presently exist that may be stable, because shortly down the road, could be 5, 10, 15 years or so, they will need replacement. And the question becomes whether or not to replace them with implant-supported prostheses or fixed partial dentures at that time will come before you and your patient. Posterior maxillas also need work to be done, and when those areas need treatment, they need bone grafting, which brings us to a presumption of how many bone grafts are going to be necessary and to what degree. Posterior maxillae characteristically require grafting in order to place adequate implants for longevity, and that presumes the number of bone grafts that would be used. And if you take a look just below here, we'll see that we have an estimate of about 95% of posterior maxillas will likely require a bone graft for optimal treatment in that area. Now, the posterior mandible, if there are 2 or more missing teeth, remember we have 2 of those as well as 2 of the posterior maxillas for every patient. For each of those that are missing 2 teeth, we can presume as well that they're perhaps about 75% of the time, as you'll see right down here on the bone grafting segment, is that we will need to restore the bone volume in those areas about 75% of the time, and that's probably a conservative estimate. So let's take a look at what might be a reasonable number. Of course, when you take a look at a spreadsheet like this, you have to ask yourself a question. Is it valid? Does it make sense? Does it make sense in your practice or anybody else's for that matter? So why don't we do this? Let's take a situation where let's say we'll use a single edentulous mandible and determine what type of revenue potential that service has in your practice. Now, we already have the fees for implants, crowns, and hybrids, so we can make some presumptions here that if we have an edentulous mandible that's to be restored and we're using 5 implants, that has a potential fee value of about $9,000 just for the placement of implants. Now, characteristically, no bone grafting is necessary for an edentulous mandible, and that's fine. The prosthetic service requires either a bar overdenture or a fixed hybrid, and let's presume that's going to yield $8,500. That provides a total value of surgical and prosthetic fees of $17,500 plus materials. So your overhead here is significantly less than, because you'd charge more than that if you provided a fee to the patient which included the laboratory fees as well as the materials that you consumed. So if $17,500 plus materials and lab costs makes sense to you, then it makes sense that the spreadsheet would have some reasonably accurate value. Now, how many edentulous mandibles are in your practice? Well, let me suggest to you that about 100 edentulous mandibles might exist in a very, very well-established practice that isn't customarily doing full dentures on a regular basis. Many practices have 500 or more, particularly if the doctor enjoys treating full denture patients, but that's not very common in North America, it seems. Our denturists have taken most of the load. But if you can see yourself clear to doing more and more dentures, you'll find that the potential you have to generate income in implant dentistry will have a marked effect on your bottom line. However, let's presume for the time being that we're using, let's say 50 cases in your practice, a very conservative number, I might add. Well, extrapolating that downward, that's over $750,000 in potential revenue sitting in your practice today. That doesn't even bring into effect the number of dollars that might come in as a result of new patients attending your practice. So just within your practice right now, 50 edentulous mandibles represents a potential of $875,000. Let's zero out that number for a moment. Let's go to maxillas. If you have 50 maxillas in your practice, the probability is that you have about 100 edentulous maxillas. So, presuming 8 implants per maxilla, that represents $1,440,000 of implant revenue just from those edentulous maxillae. Combined with the bone grafting value of about $500,000 has a potential of yielding $2,830,000 of revenue just in those procedures for those edentulous maxillas. Quite astounding. Let's add back that 50 implants that 50 edentulous mandibles that we talked about, and we're at $3.7 million of revenue just for your edentulous cases alone in your practice. We haven't even started talking about partially edentulous arches. Let's have a look at the number of missing teeth in the premaxilla for your patients. There's an interesting consideration between the relationship of number of missing teeth in the posterior maxilla and the posterior mandible relative to the premaxilla. Since teeth are lost much quicker in the posterior maxillary mandibular areas than the premaxilla areas, it's reasonable to draw some conclusion as to the number of patients that you would have. Additionally, there are 2 posterior maxillae compared to a single premaxilla, and likewise with a posterior mandible. If your practice is quite a mature practice, it very likely has a high number of people who do miss 2 or more teeth in their premaxilla. It is not uncommon for a practice that has been 10 years in its building to have 500 people missing 2 or more teeth in the premaxilla. These areas may be inappropriately restored, need restoration today, or adequately restored at present time, needing restoration in 5, 10, 15 years. But either way, they exist as potential implant treatment procedures now or in the future. If we presume that your practice has 500 patients with 2 or more missing teeth in the premaxilla, what does that constitute in terms of potential work in implant dentistry, both surgical and prosthetic? Well, if we take a look at the bottom here, we see that we have $6.5 million of potential revenue when included, along with the fully edentulous mandibles and maxillae. It's an awful lot of revenue to be generated. It certainly challenges the mind logistically as to whether these numbers are valid, and I can assure you that they are. I was so astounded by these numbers when I first came upon them, I thought that maybe there was a decimal point missing someplace or placed inappropriately. And having gone over these numbers on a regular basis, just time and time again, I finally came to the appreciation that these numbers are relatively accurate. Let's move on to the posterior maxilla now. Now, when you consider restoring posterior maxillas, there can be as many as 4 teeth missing. Now, we can assume that the average of 2 teeth are missing when a posterior maxillary edentulous condition exists. So we can even discard and not even consider the number of single tooth posterior maxillary restorations that are in everybody's practice. Well, if we are missing 500 patients have 500 teeth missing in their premaxillas, we can consider that very, very probably there is as much as 1,000 patients in your practice, or let's say 1,000 posterior maxillas that are missing 2 or more teeth, considering the possibility of every patient having 2 of these areas. That is not an unreasonable number. And if we add in the number of posterior mandibles, and I think it's appropriate to consider that there should be an equal number of posterior mandibles are missing 2 or more teeth as there are in posterior maxillae. Well, if we take a look at the potential down at the bottom of the screen here, we note that this particular practice has 23,640, excuse me, that was a wrong number, $23,645,000 of potential work. And that is, I think, for the most part, a ridiculously high number for most of us to consider. Even if we're 90% inaccurate with this, it would be a number that would be reasonable to look towards as far as a return on investment for the training and time it took, whether you did this now or later. The important thing to consider is that regardless of the cost of training, the return on investment is so high that there is almost no consideration for an inappropriate amount of investment for the training process. You have a choice of whether or not you can refer this work out or take it on yourself. The number that you see at the bottom of your screen is $23,645,000. A huge number and arguably a ridiculous number to consider as far as potential treatment in your practice. The reality is that you can't hope to convert everybody into a person who's going to accept treatment, and in particular comprehensive treatment. But a good part of them will, and you don't need much of that total amount to make it worthwhile to consider implementing implant dentistry at a comprehensive level into your practice. Keep in mind that the numbers we've used here are conservative numbers at best. You can apply your numbers in your practice to evaluate whether or not these numbers that you see here make sense. I should point out that in practices that we've looked at in the past, where doctors have given not only their practice fees but also the demographics of their practice to us, that we've had highs of as much as $53 million of practice potential in demonstrated. We have never had a practice that yielded less than $15 million of practice potential. Let's just presume for a moment that we're 50% wrong in these estimates. That number is still so significantly high that there is no question whatsoever that a return on investment is so high that regardless of whatever fees that are charged to acquire the knowledge and clinical training to provide these treatments would be appropriate. The people who are considering these services, the majority of them anyway, are called baby boomers. Now, who are baby boomers? Baby boomers are the people who are born to a group of people who emerged from the Depression in North America, who struggled through their whole life to be able to eat, to save a dollar, who sacrificed hugely, and these are the same people who vow that their children would never suffer what they suffered. These are influenced by the prosperity of the post-war years as they grew up, who have never wanted for anything, who got whatever they wanted because that's what their parents wanted for them. Through each generation, from the days that these baby boomers were in diapers, they have rewritten the principles of consumerism. And we are faced with a group of people today that are in their 50s now and they're losing their teeth. These are people who have completed their education, have paid for their homes, and they have an immense volume of wealth sitting at their disposal. In fact, these people control 70% of the wealth of North America. These are people who expect and have expected their whole life to have the highest quality of life that they could ever afford or otherwise. These are the people who are spending billions of dollars on facial cosmetics to retain their youth. These are people who will buy implant dentistry services from you or the practice down the street, depending on who will provide the quality of services that they're looking for. These baby boomers are the people that don't want to put their teeth in a glass of water on their night table at night. Forward-thinking colleagues that understand this principle are working smarter, not longer, reaping huge economic rewards. This is your call to action, to evaluate your practice in terms of this modality of patient care. We are happy to discuss any aspect of this with you and to help you evaluate your return on investment for making dental implants a part of your dental practice. Please contact us at any time at 1-800-642-8593 or visit us on the web at www.pacificimplantinstitute.com.